Good afternoon. My name is Robert Walker, and I'm Brand Manager for RetirementHomes.com. Welcome to our March webinar. We are North America's leading online sales and marketing solutions provider, including our housing directory, our online library, and e-newsletters. We also offer, free of charge to senior living professionals, the top experts in senior living every month who will share their knowledge in the fields of marketing, research, sales, and related areas in webinars such as the one you're about to hear. This month, we welcome back Irving Stackpole of Stackpole & Associates. Irving's presentation, The Birth Dearth, Why Occupancies Are Low and What to Do, will share the impact and explore the impact that demographic changes will have on the senior living industry. There will be a question and answer session at the end of the presentation. If you would like your question answered, raise your hand in the toolbar to the right, type in your question, and time permitting, it will be answered at the end of the session. And of course, you are also welcome to ask a question anytime during the presentation itself. Now here's Irving.
Well, good afternoon, everyone. Thank you for that introduction, Robert. And what my agenda is today is to review some demographic facts and to then go through the consequences of those facts to the seniors housing and services providers, which I assume makes up the vast majority of the 52 of you who are online right now. And many of the facts I'm going to present to you will be extremely familiar and will resonate with you warmly. Not quite as warmly as the candle on this lady's cake where she's igniting her cigarette with the glow from the candle of her 100th birthday. I also want to acknowledge that some of the information that I'm going to present is from the Census Bureau and other sources, but of course I'll also be injecting my opinions, and they are just that, my opinions about the future. I don't have a crystal ball. So what I'd like to do is to begin by reviewing some facts. Here are the 4 points I wanted to make that I will be focusing on, what we can do: reduce objections, defend, protect, and fortify, improve productivity, and innovate. So the question is, how bad is it? Well, these are NIC data that clearly shows that nursing care data shows that the occupancy and supply is, occupancy is declining, as is supply, and it has been for quite some time. Data from the American Healthcare Association shows that the occupancy in skilled nursing has also been declining, and while this particular slide shows that it's currently at 87%, depending on the state you're in, the national average is slightly under 84%. So occupancies continue to decline in skilled nursing. And here is a national chart that depicts the occupancy in skilled care by state. And as you can see, there are many states that have 62 to 79% occupancy, and a few that have 89 to 93% occupancy. And as I said earlier, national averages are down just below 84%. The CCRC sector, I'd be curious to hear how many of you represent CCRC product. The CCRC product has also been declining and is currently at about 87%. So the supply has been contracting. There's been no new development, and there has been departures by skilled nursing centers from the supply in skilled nursing care, both in response to declining demand. So the older age cohorts, those groups of individuals who are older, are indeed our markets, and there have been significant quantitative and qualitative changes in those markets, and I want to focus first on the quantitative change because it's the most impactful. But I've got a bit of a quiz here that I like to ask in my in-person sessions. The question is, are the aged cohorts increasing, decreasing, some going up, some going down, or staying about the same. And I get a mixture of answers. Very often I hear, oh, the aged cohorts are all growing because people over 65 are growing and people 85 plus are the fastest growing group. Well, the fact is that we are encountering a situation where we're seeing the result in our markets of what I refer to as the birth dearth. And if you look at this table, this is from the Bureau of Census. It depicts the live births in the United States from roughly 1910 until 2010. And I've drawn an oval around this area in this chart from 1925 to 1945, and I call this the demographic dip or the birth dearth. And what was going on in the country explains to a significant degree why the birth rates plummeted as they did. This was the time of the Dust Bowl and the Great Depression. So the birth rates were far lower during this period than in any time previous. And in fact, this 20-year cohort is about 4.5 or 5 million smaller than the prior 20-year cohort. And it is the smallest cohort on record in the United States. Now, why this is relevant to us is that we know from CMS data and from research that was recently conducted by Nick that the average age on admission to both skilled nursing and assisted living is about 86 to 87 years of age, which means that an individual born in 2012 would be 87 years of age, going on 88 years of age in 2013. And as you can see, immediately after 1925, when this person, this hypothetical person, would have been born, the birth rate plummets. And in fact, in 2017, you can see that the birth rate has declined further and that it continues a very steep fall, so that in 1935, an individual born in 1935, the birth rate began to level out and began to go up a bit, but an individual born in 1935 will turn 87 in 2022. So from 2012 to 2022, we will be experiencing and seeing in our markets individuals who were born during a period of this very lessened, far lower birth rates. And this is what I refer to as the birth dearth or the demographic dip. It's very useful to think of demographics in very small slices because indeed we don't make 20-year plans in our seniors housing and services businesses. We make year-by-year plans, and understanding whether the size of the market will be going up or going down is extraordinarily relevant to that planning. In addition to the market being down, being smaller, in other words, the market for our services, the age-qualified individuals in the United States, our market for seniors housing and services solutions, not only is that market declining, has it declined and is declining, the mood of the market isn't very upbeat either. As we can see from this graph from The Economist magazine, the employment to population ratio and real median incomes continue to decline. This is creating economic pressure in the marketplace that many of you with families and other financial obligations can certainly resonate with. And this very powerful graphic from the Wall Street Journal depicts this most recent recession, which economists are referring to as the Great Recession, referring to the employment rates and the rate of recovery of employment. As you can see in the other 5 recessions that are depicted in this graph, unemployment recovered quite quickly, whereas unemployment in this most recent Great Recession has recovered very slowly. This has very significant impacts on the mood of the market and the willingness of individuals in our market to consider what many see to be additionally expensive solutions, even though they aren't necessarily. So where is the demand? Where is the opportunity for our seniors housing and services sectors? Well, many people say, well, arthroplasty, knees and hips and these things are going to supplant the demand for services being provided to the older population. And in fact, arthroplasty, hips and knees, has been a financial boon to many skilled nursing centers. The numbers of these hips and knees is depicted in this graph. The 2005 to 2010 numbers on the left-hand lower side of the graph represent the actual data. This is from the Journal of Bone and Joint Surgery, a real page turner. I read it every night. It puts me right to sleep. But as you can see, the anticipated rate of growth of hips and knees is depicted in these graphs. So as we are here, that is to say roughly around 2013, we don't get a dramatic inflection in the number, the quantity of arthroplasty cases until roughly 2015, 2016. And again, this data reflects the demographic data that you saw in the live births chart. So there are about 300,000 hips and knees done in the United States, and that the rate of hips is going to grow pretty significantly at 20 to 30%, but the rate of knees is going to grow very significantly, as you can see from this chart. Some other people say, well, we're going to make up the absence of older folks. We're going to make up that market loss with individuals who are suffering from Alzheimer's and related disorders. And here we have a graph that depicts the demand for Alzheimer's and related dementia care, and we are at about 2013, but the demand for those services don't really reach inflection point until somewhere between 2017 and 2020 as well. So while there is certainly demand for services for persons with Alzheimer's and related disorders, we can't be lulled into a false sense of security that either Alzheimer's and related disorders or arthroplasties will somehow make up for a fundamental loss in age-qualified consumers in the markets. So, to quote Randy Newman, I'm a big fan of Mr. Newman, it's a jungle out there. It's a challenging market, and many of you will resonate very well with that statement because you've watched the competition become more aggressive to the point where it's almost cutthroat. I hear regularly clients of ours complaining that, well, the place down the street isn't at all qualified to take these high acuity cases, and yet they're taking them on anyhow. They're going to get in trouble. So highly competitive behavior is yet another example of what happens in a market when the market begins to contract, when the demand begins to decline. And that's exactly the situation that we've got. And those of you who are in the sales business will recognize that this poor fellow certainly reflects your experiences in having to tell your executives and boards that we missed our numbers or that occupancies are declining, or fill in the blank for another challenging issue in the marketplace. So the conclusions we come to are pretty sobering. First of all, that the market is stagnant or declining. The size, the quantity of the market is stagnant or declining. Second, disability rates are declining. We hear at conferences, and I read in the journals, saying that, well, there are fewer patients, there are fewer consumers utilizing skilled care, but the ones who are there are sicker. There's actually not a lot of data to support that suggestion. In fact, there was just recently a published report indicating that that is not the case, that disability rates in skilled care haven't changed profoundly. Certainly the average age on admission to assisted living and other types of services is going up, and so these individuals are more frail. But the overall disability rates are not going up there, in fact going down. Thirdly, there are definitely more options available to consumers today and their adult children than there were even 3 or 4 years ago. Part of the Affordable Care Act, with which I hope you all become familiar, part of the Affordable Care Act is to provide states with incentives to the degree they succeed in keeping consumers out of nursing homes. So I have a home in Rhode Island, and Rhode Island has been extremely aggressive in promoting independent care through its various state agencies and state-sponsored organizations to keep people out of nursing centers. So there are more options, and those options are being promoted at a progressively more aggressive degree. The acuity for consumers is not going up. Dependency on ADLs and IADLs, as I said earlier, if they are going up, it's in they're in very narrow segments of our overall consumer market. And even though we are an aging population and an aging society, and therefore we are carrying disabilities into age at a higher rate, the incidence or burden of those disabilities seems to be going down, is definitely going down in certain categories. That is a result of lifestyle changes and improvements in healthcare and medical care. On the supply side of this equation, as many of you will identify, the inventory of, I call it a product here, the inventory of seniors housing is mixed. Certainly nursing centers are old. There's very few newly built nursing centers. The state's Certificate of Need program have created significant inhibitions, and of course the demand in the marketplace has also quelled any motivation and any fervor for building skilled nursing. So, and in the assisted living marketplace and the continuing care retirement community marketplace, in particular over the past 4 years, because of the difficulties in the capital markets, the rate of renovation, innovation, or as some of the capital markets folks like to call it, repositioning of these products has slowed. It seems to be picking up a little bit now, but still the capital markets are challenging and not as available as they certainly were. So these are market conclusions that we have to embrace and work with as sales and marketing professionals in the seniors housing and services sector. So I'm going to drill down or drive home just a few points about what it is that we can do, and I'll necessarily speak it generally, and I'll try to get as particular and as practical as possible. But the 3 points I want to really drive home are that it's necessary for us to fortify, protect, and defend our existing market share. Those of you who are working with established providers of seniors housing and services solutions have a particular market share in your geographic marketplace area or multiple marketplace areas. It's terribly important to secure that market share because the marketplace will soon become, if it isn't already, hyper-competitive, where service providers and housing providers will step out of their usual and customary service realm and begin to offer additional further services and become even more competitive to your core business. So if you've got market share in a particular segment, you can be sure that that market share will be challenged very, very soon. The best example of fortifying, protecting, and defending your current market share is managing toward loyalty rather than toward satisfaction. And I can talk a little bit about that as we move along. The second point is productivity growth. We must improve the cost-value equation in seniors housing and services. As a sector, we have relied upon the available referrals and the available payment sources, and we've adjusted our product and our performance standards to meet those characteristics in the marketplace. We have not historically, not very many of us anyhow, we haven't looked to import some of the existing productivity improvement models that exist in many sectors into seniors housing and services. And in particular, I'm thinking of econometric models, I'm thinking of continuous quality improvement models, where we're looking at measures of effectiveness, measures of output by what is arguably our most important asset in the sector, which is our staff. So we haven't done a very good job in terms of productivity growth, in terms of analyzing productivity and enhancing productivity growth. The third point has to do with innovation. It seems paradoxical that while we're circling the wagons in point number one, fortifying, protecting, and defending our market share, that we also, almost at the same time, are challenged to innovate, but that's where we are. In other business case examples of declining or stagnant markets, these were the steps that companies and businesses adopted, and these are the steps which have been demonstrated to achieve survival and ultimately thriving in those sectors. So to fortify, productivity, and innovate are the three principles. What I'd like to do is I would like to stop here. I'm sure that there's lots of questions, and I'd like to field questions from you and hear your thoughts on what I've been presenting.
Thank you again, Irving. We do have a couple questions coming in. Again, a reminder to everyone, if you would like to ask a question in the toolbar to the right, raise your hand, type in a question there, and then we can unmute your microphone and you can ask directly, or if you prefer, you can type it in. Definitely a great opportunity. So we have a couple questions here already. The first one is, basically I'm just kind of paraphrasing, but this sounds counterintuitive, what you're saying. This sounds like we're not hearing it elsewhere. Why aren't we hearing this kind of information elsewhere?
What a terrific question, Robert. You're not hearing this elsewhere because it's not in anybody's best interest to tell you this information. So if you think about the advocacy organizations that usually provide support for the sector, these are the Assisted Living Federation of America, the American Healthcare Association, Leading Age, AARP, and others. It is not in their best interests to communicate broadly, widely, and intently that before we get to the quote-unquote baby boom, we had a quote-unquote baby bust, and that the size and number of age-qualified individuals is actually going to be declining before it goes up. And if you go back, I'll go back to this chart, which may be the most important chart in the presentation. As you can see, after 1945, or just before 1945, there's a spike. But then after the war, of course, we all know about the famous baby boom. So even more precipitous is the growth than the decline. But it's not in anybody's, it's not in any of the established organizations' best interest to promulgate this information. That's one of the reasons why I've brought it. It's one of the reasons why it seems counterintuitive and it hasn't been more widely discussed. I have discussed this with people at Leading Age and people at Alpha and people at the American College, and while the facts of the birth rates are irrefutable, typically the pushback I receive has to do with, yeah, well, arthroplasties are going to make up the difference. Yeah, well, Alzheimer's is going to make up the difference depending on which sector is being represented. And, or, yeah, well, diabetes, because we have such an obesity epidemic in this country, they're all going to make up the difference. And, well, I've looked at those, the incidence and the disease burden associated with those numbers, and with very few exceptions, they just don't make up the difference.
Okay, thank you, Irving. We do have a question from Anthony Cirillo. Anthony, ask your question, please.
Jake, I was wondering about covering a couple items. Brand extensions, how, you know, one of the things I talk about with people I work with is, you know, how are people going to extend their brand into the community and, you know, realize that aging in place is taking, you know, is a real phenomenon, and people need to bring those services out there. And comment, because I do a lot of work on the hospital side, and people are, you know, all you hear about is this whole rehospitalization issue, being a partner to hospitals. So how do you see those in terms of prospects for the industry?
Good question. Thanks, Tony. It's good to hear you. So with regards to brand extensions, typically brand extensions refer to things like, well, right here in Boston, the Massachusetts General Hospital 2 years ago opened up a quote-unquote MGH Children's Hospital. Now, they always had a building devoted to pediatrics, but they branded their children's units, pediatric units, as MGH Children's Hospital, and it was a huge flop. Brand extensions are very challenging and need to be done very carefully, but I think in your question you were also asking about projecting your brand into the community and building awareness of your brand in the community. In a declining market, in a stagnant or declining market, this becomes extremely challenging because the budgets typically for marketing and communications are shrinking along with the net operating margin of the unit. So the best marketing tools which have been used by low-margin businesses forever are loyalty programs. And I alluded to loyalty a little bit earlier, and I didn't really drill down on it. We have existing consumers and customers in our businesses, and we traditionally, hospitals are getting a little better at this, but healthcare providers in the seniors housing and services sectors have just not done a good job at building loyalty programs that create communities of advocates in the community at large for their brand and for their services. And those are low cost. That's an example of a low-cost, high-impact marketing and sales brand building tool. We also advocate for our clients to become very aggressive about public relations. Precious few seniors housing and services providers have, for example, really learned how to use press releases properly and using them to help build the organic rankings of their websites. We haven't really talked about the marketing channels, but in terms of building awareness, brand, I think what you were saying about brand extension, Tony, has to do with, Anthony, has to do with building awareness in the community and communications about programs and creating value-added information opportunities in the community where, for example, a home health care provider does a series on healthy aging where the issues of visual impairments and how to identify visual impairments, removing obstacles around the home to prevent a fall, recognizing when mom isn't taking her medicines properly, when is it no longer safe for dad to continue to drive. These are issues that the social services professionals, the healthcare professionals, and others in our sector understand very well because we work with it on a regular basis. And I believe strongly that putting that information out there and branding it with your organization's brand is a terrific way to create this, as you were referring to it as brand extension. And finally, Anthony, your point about rehospitalization. The CMS has created, the new ACA has created the Center for Innovation within CMS, and we're going to see a very exciting array of opportunities for healthcare providers to innovate. What CMS is also simultaneously trying to do is to identify the drain holes and plug them. And it was very clear that readmissions, based on a paper that was published back in 07 or 08, it was very clear that nursing home frequent flyers were costing somewhere in the neighborhood of $30 billion unnecessarily to CMS on some sort of a projected basis. And that certainly got people's attention. And so we have initiatives to create penalties at the acute care general admitting hospitals for readmissions in the 3 broad diagnostic categories. Where I urge my clients in the seniors housing and services sectors to use those is to take transitions of care programs to their upstream referral sources and to their collaborators, their colleagues in the sector, and to develop transitions of care programs to show the other players in the marketplace area that you're the nursing home, you're the assisted living, you're the pharmacy services, you're the home health care, you're the provider to deal with because you understand what the challenges are. And by staying in dialogue around issues such as rehospitalization, you have further built and developed your brand, and that goes to the issue I was talking about earlier of innovation and differentiation. Did I answer your question, Anthony?
I think so. Excellent. Thank you very much again for that, Irving. We have another question here. Actually, can you go back to an earlier slide? You mentioned about reducing objections. I'm wondering if perhaps you can expound on that a bit.
Yes. I thank you, whoever it was that brought that up. Here's the thing about our sector, and I'm admittedly a little focused on the skilled side of the sector, but this applies certainly to home health care and somewhat to assisted living. If you read the language on websites and brochures, which we do all the time, if you look at the images that appear on websites and brochures, and you really objectively look, you will be astounded at how negative they all are. We in the seniors housing and services sector are responsible for perpetuating much of the negativity that's associated with our sector in the public at large. Now, the method, means, and manner of communication, which I refer to as the metaphor, states that nursing centers and assisted living residences are awful places. They're terrible places, and after hundreds of focus groups listening to seniors tell us and our clients, where seniors say, these are awful places, I'd rather die than go to one of these, we begin to understand that the sector has created much of the metaphor associated with the negative metaphor associated with the sector. I'm going to zero in on a couple of things. The first is the quote-unquote F word. Now, a skilled nursing center in the United States, according to regulation, is called a skilled nursing, and you're all saying to yourself silently the F word, skilled nursing facility. Unfortunately, the regulatory language has institutionalized that expression. So you'll hear very frequently nursing center managers and nurses talking about this quote-unquote facility. Well, in our culture, in the United States, and in the UK for that matter, there's only two other things to which that word facility is generally applied. And they are, number one, a bathroom, and number two, a prison. So we are perpetuating negativity by perpetuating this word. There are many other words that we could use, and I would urge us to find them and use them and to expunge that word from our lexicon. The second example has to do with the verbs and the adverbs we use about the transition from where mom is now to our service venue or our housing environment. And I would strongly urge you to look at your brochures and to look at your websites, and you will find put, quote-unquote put, and quote-unquote place, and quote-unquote placement, as though mom were a potted plant. This too perpetuates the negativity associated with the sector. And I would urge us to look at this language and to find new, there's lots of examples in the real estate sector and other sectors, look for new ways to describe the transition from one place to another place, from one venue of care to another venue of care, in order to begin to remove some of this objection. So that's what I meant by reducing objections. We have created much of the language which perpetuates the negative stereotype, the negative image. For those of you who are Britcom fans, you'll recognize faulty towers and the images associated with faulty towers.
Okay, Irving, we have another question here from Karen Hogan. Karen, please ask your question. Hi, Karen. Okay, so looks like Karen's left the call, but I do have the...
She fainted while she was waiting.
So her question is, you know, I'm 60 and working, and I'm concerned about, you know, the sequester. How do you feel the sequester will impact the ability of independent living sites to continue to keep costs down and to exist for those of us who are not there yet?
Wow, what a good, complicated question. So the sequester is just another example of how the sector will be expected to do more with less. So I had urged in this, on the slide that's on the screen now, I talk about improving productivity. That isn't really a suggestion or really a recommendation. It's an absolute performance mandate, because we will be paid less and expected to do more. The sequester is not just an example of that, as is value-based payment. The CMS is very committed to value-based payment. The Affordable Care organizations are one example of value-based payment, and we will see more of that. Value is cost divided by quality, and we will see that equation used over and over and over again. So the sequester will certainly have an impact on those organizations that are partially state funded and or completely federally funded, but the overall survival of those organizations is more a function of the response of organizations in a particular marketplace area to the very challenges I've outlined here. So not only are we going to get paid less, but the market, the number of individuals who are utilizing our services will decline, and that will require all of us to innovate and to improve productivity and to protect and defend our market share.
Okay, we have another question here from Beverly. Beverly asks, what are some of the most innovative initiatives you've seen implemented which have differentiated a facility from another?
There's the F word again. Okay, Beverly, the F word notwithstanding, what I've seen in forward-leaning institutions is I've seen nursing centers organize ACOs. Now, think about it. ACOs, there are about 400 of them now, but ACOs up to this point are all led by hospitals and or by doctors. Why shouldn't a skilled nursing center be the lead dog on an ACO? And in fact, there's a couple that are trying to do just that. And the most innovative differentiating initiatives I've seen are around transitions of care which integrate the performance of pharmacy services providers with home health, with skilled care, with LTACs, with acute care general admitting, with physicians. Those initiatives that embrace the full spectrum of care being provided to the consumers in the marketplace. These are far and away the most innovative examples I've seen.
Okay, we have Nina who asks, how do you build a loyalty program if her purchase is a one-time event and then the customer dies?
Okay, that's a very good question. And the simple answer to that is by securing an agreed upon contact with the family or the responsible parties associated with the individual. So if you're a hospice provider, for example, and so your primary customer, your consumer, is going to pass away, but the customers, the family members, and the referral sources, the doctors, the nurses, the case managers at the hospitals, these individuals are part of a sphere of influence which can and should become a growing community of support for your brand. Everyone recognizes hospice. Hospice is spoken with hushed respect in all of the healthcare sectors, but your brand needs to differentiate itself, and it can by extending and expanding the community. This is a great example of the term social networking has a social sciences root and not just a Facebook and Zuckerberg root. Social networking has to do with identifying individuals with similar interests and finding ways to be in dialogue with them. And that's how I would do that. And a loyalty program is nothing more than a way to build preferred reuse. So those same individuals, and I don't know if Nina is working with a hospice, but it seemed like a good example. Those same individuals, the brothers and the sisters, my sister passed away recently, those brothers and sisters will be in a position to recommend and or utilize and possibly even donate to this hospice in the future, and how the hospice manages that contact and maintains that community is pivotal to the success of those desired outcomes, and that's an example of a loyalty program. I hope I answered your question, Nina.
Thank you, Irving. We do have a question here from Mike, and Mike asks, why does your data contradict the projections of the census population?
Well, these are, so good question, Mike. These data, these live births data is from the Census Bureau. What you may be referring to is there have been some studies done by other organizations projecting growth in the aged cohorts. And you need to be very careful in looking at this. If you're a demographer, you've got a background in data analysis and statistics, Mike, I apologize, I don't mean to speak down to you, but we need to be very careful in looking at these data because we need to look at the difference between a rate of growth and an overarching number. The projection between 2010 and 2020 is very salutary, but there's a lot of stumbling that will go on between 2010 and 2020. So my data is based on this this chart that I've shown here. This is census data. This is the United States, live births in the United States. Do you want to ask a follow-on question, Mike?
Mike mentioned he's not on the phone, but Mike, definitely pass on. You know what, Irving, if you can perhaps pull to the contact page, so if Mike or anyone else would like to ask follow-up questions, they'd be able to do so directly.
Absolutely.
But are there any other questions at this point, just before we sign off? Okay, great. Once again, thank you very much, Irving, for that fascinating presentation. That was Irving Stackpole, Stackpole & Associates. His presentation will be available both on our website, retirementhomes.com, and at youtube.com/retirementhomes. Again, check retirementhomes.com for information on all our monthly upcoming webinars, or contact me at robert@retirementhomes.com for details, and feel free to contact either of us for questions pertaining to this session as well. Thank you very much. Have a great day.
Thank you.